Dementia is not a mental health condition or a mental health diagnosis. It is a medical condition, a neurocognitive disorder. Therefore, behavior health or mental health medications should be taken with caution. Simply because the doctor has prescribed the mental health medication does not mean that the person should take the mental health medication for dementia. So, if the person has a progressive type of dementia and the doctor prescribes a behavior health medication to, I don't know, address the behavior of wandering, there is no medication to control wandering. It's probably a sedative, a medication that's going to sedate them, that's going to significantly reduce their quality of life. It's going to put them at higher risk for falls, which is going to require more work, more worryation, more anxiety and depression on behalf of the family caregiver. So, if the doctor prescribes your loved one a behavior health medication or a mental health medication, such as Seroquel, the generic is quetiapine. That is a medication that's typically prescribed for schizophrenia and bipolar. Dementia is not in that. Neurocognitive disorder is not in that. You want to talk with your doctor about the benefits and the risks. If their behaviors are not dangerous or causing any level of distress, then you would want to look at non-pharmacological strategies, because those medication could indeed cause adverse responses, and it could actually increase whatever behaviors you're experiencing. It could actually cause those behaviors to get worse. It could exacerbate them. There is a list of medication that has been developed by the American Geriatric Society. It's called the Beers Checklist. That's BEERS. It is linked here in the video. You can just click it. And it is a list of medications that you want to use caution before giving. You want to talk with the doctor again about the benefits and the risks. If the risks are greater than the benefits, then you may want to look at some alternative measures. And when I say alternative measures, I mean more lifestyle changes. A lot of times those behaviors come about, and when I say behaviors, I mean the challenging behaviors, the ones that are causing harm, come about as a result of how you, the caregiver, are communicating with them. How are you sharing information with them? What does your body language look like? Because they're going to be more in tune as the disease progresses with not necessarily what you say, but how you look while you're saying, the intonation and the inflection of your voice, your body language. Do you look like you want to help them? Do you look like you have compassion? Do you look like you care? Do you act like you care? And if you don't, then they're going to respond to that. If you look negative, they're going to respond negative. So if there are challenging behaviors occurring, and by behavior, I mean everybody has behaviors can be negative, they could be positive, but behavior is the way we act and how we respond to stimuli. So if the way they respond to their stimuli and their environment is dangerous, if it's causing distress, then you do want to talk to the doctor about it. But a lot of times, 9 times out of 10, the doctor is going to prescribe you a behavior health or a mental health medication, so that way it actually treats you, the caregiver, and not the person, because it's going to reduce their quality of life significantly. So you want to look at the environment, you want to look at how you're engaging with them, and print out that checklist that's linked here. Print it out, look at all of the medications, because it's a lot of them. It's more than just the behavior health medications on there. There are antihistamines on there. And the checklist is not saying don't give this to your loved one. It's saying this medication is not recommended. However, if the doctor says the person needs it and you want the person to take it, check out these risks, because actually some of these medications, the side effects could increase their risk of death. And so you want to be very, very careful about that, and also increase their risk of stroke activity. So print the list out, take it with you to every doctor's appointment, because at any given point in time, any of their doctors could recommend a behavior health or a mental health medication if they're dealing with some challenging behaviors. And so I want you to be well aware that if given the medication and the dosage is high, it's not at the lowest effective dose, it could put them at higher risk of falls. It could actually make the behaviors worse. And that's going to be much more challenging for you to provide care. And it would definitely decrease their quality of life and yours as well. So I hope this helps.